And so 5 patient care delivery models. Take notes. These are kind of important to know. You may end up using one or more of these on your job. Total patient care or private duty is simply that. You and one patient. You provide one-to-one care. You provide all the care. And where would you see this in a hospital? Well, critical care, emergency department, women's health. You'll see one-to-one or one-to-two type nursing where the nurse does everything. And a lot of nurses really like this because you have total control over everything. You are in constant contact with the patient. You don't rely on anyone else to tell you what's going on because you're there for everything. You know how they eat, how they sleep, how they walk, how they turn. You know everything about that patient. But it's expensive because it's one nurse and one patient. So it's only used for the most critical patients. You may end up working like this. I have when I worked in critical care and the ED. And this is probably among the most popular for nurses because it is so focused on you and your patient. You don't worry about everybody else. You don't manage other people. It's just you and the patient. On the other hand, it's just you and the patient. And that can be challenging too. Functional nursing is where jobs are broken down by function. So it could be a team of one or more RNs and maybe an LPN, maybe a CNA. And every person has a task. So potentially, let's say you have a team of 2 RNs, 1 LPN, and a CNA. One RN does nothing but assessments. One RN passes all meds. The LPN performs all dressing changes, and the CNA provides all ambulation and feeding. So it has good points and bad points. The good points is if one person does the assessments, that person knows everybody on the team. And they're able to compare person to person and notice changes. When you assess the same person multiple times in a row, if there's a difference in breathing pattern, you'll notice it because you're the only person assessing them. On the other hand, it provides fragmented care. So I'm in there doing a little bit, then you may never see me again. And then another nurse will come in and then you won't see that person again. So you don't develop a relationship with the patient as well. But conversely, sometimes the patients like this because they have more people caring for them. They may not know who's going to be coming in at any given time, but they know that they have a lot of people that are caring for them. So patients sometimes like this. The biggest problem, though, is when something slips through the cracks. The assessing nurse goes through, the medication nurse goes through, and doesn't notice or notices something is wrong, but assumes the assessing nurse also saw it. Well, if it happened, if that change occurred in between those 2 nurses, the second nurse should report it, but doesn't know it needs to be reported. So sometimes functional nursing can result in fragmented and uneven care. It is a pretty common form of nursing, though. Team nursing is similar. So a group of nurses, the RN leads the whole team. The patients are broken down so that the RN may do these people. A second RN will take care of these, or the LPN will take care of these. The CNA might be responsible for all the vital signs or whatever. So it has aspects of functional, but it has aspects of private or total care too, because while the CNA might be doing all the vital signs, I'm caring just for these people. And this other nurse is caring for just these people. So there is that blending, and it is more of a team atmosphere. It also provides overlap so that if my 2 people, let's say my 2 people get really, really sick, they start crashing, another nurse can come in and help me out. That doesn't happen in private total patient care or private nursing. If my patient crashes, it's me. So team nursing is very, very common. Holy Family does it wonderfully. Holy Family, there is usually for every group for about 8 patients, there are 2 RNs, and for every 12 to 16 patients, there's 1 CNA, and for about every 30 or so patients, there's a unit clerk or health unit coordinator. So they do team nursing very well at Holy Family. There's primary nursing. Now, this is not private duty or total patient care. Primary nursing is different. Primary nursing is true management. If you work in a primary nursing facility, you as the RN, you are responsible for that patient for 24 hours. That doesn't mean you're on duty 24 hours, but for 24 hours, you are in charge of everything. Everything, all care coordinates through you. So you are working on the discharge plan, you're working with the physician, you're working with respiratory, you're working with physical therapy, you're working with the nurses who are actually providing the care, because you're not. You're managing. You direct what's going on, because everything goes through you. This is a complex form of nursing. It requires that you have only nurses, no CNAs, but because you have one person and everything is running through that person, you have smooth care. It's very coordinated, and patients end up getting discharged relatively quickly because there isn't overlap, there isn't duplication, there isn't somebody forgetting something, because that nurse, that primary nurse, is responsible for all that's going on. And then there's patient-focused care. And patient-focused care is also, it's a relatively new type. There's an RN, and there's other associates, might be unlicensed or licensed, but everybody does everything. So the health unit, the CNA might also be doing the lab draws. The nurse might be doing the EKGs. The other nurse might be working on dietary for the person. So everybody is cross-trained to provide care in many different areas, all focused on the patient. This too provides smooth care, but it's a little bit harder for the nurses because you have to be able to do more things. The downside there is, while you can do more things, you're probably not expert in any of them. So that's a downside with patient-focused nursing. Whereas with functional nursing, you do one thing, but you're really good at it. Patient-focused, you do everything, and you're just good at it. So that's a downside there. Patients like patient-focused nursing because they don't have to worry about other people coming in. They know that it's going to be just like maybe their nurse and a CNA providing everything. So those are the 5 types of patient care delivery systems. Functional focuses on specific tasks. It is a task-based delivery system. Total patient care, it's one-on-one nursing, you and the patient, for everything. Team nursing, there's multiple nurses, RNs, LPNs, and CNAs, and they function as a team, helping one another. Each has their areas of primary responsibility, but you can flip over and help as needed. Primary, one nurse organizes and manages all cares around the clock for all disciplines. And patient-focused is the idea of cross-training to provide cares across borders, so that everybody can do everything, and whoever walks in that room can provide the care that's needed. 5 patient delivery systems. Come back for the next, and we're going to be talking about the most effective models of nursing care and staffing issues.